so variable that no one actually knows quite what to expect.
Mhm.
I think the only reliable thing that you can expect is that to some degree for us, it's relentless. It has been relentless. It's continuing to be relentless, and it will be relentless. When all the drama of COVID stopped 12 months ago, we saw this tremendous spike. So there's relief in the community, but there's increased anxiety for us because it's busier than ever before. And so you look at it from an emergency perspective and you say this creates tremendous challenges because all these challenges are felt across the board. They're felt in outpatients, they're felt in surgery, they are felt in medicine. And so you don't just have emergency departments being really busy, but you have them being really full.
Yeah.
And they also struggle to move patients. And so the whole system just kind of backlogs across the board. Well, I think that I always say that I think we are very lucky that although we see parts and components of the hospital as functioning independently, it is actually such a supportive organization or team to work within. There's not a single part of this hospital that doesn't get affected by another part. It is it's a bit like a spider web of intricate connections that you can't quite figure out, but yet somehow if you pinch on one end, it will make the other one shake. That's been our, for lack of another term, our saving grace is the way that we really look at our care provision and say that we are, at the end of the day, it's an intricate network of individual factors that gives us the ability to really care for someone from the front door right through to the back door. And that's been, to some degree, almost our secret to the success we've had or the ability that we've had to maintain the excellence of care that we're known for and that we're so proud of. And that's a big thing, that pride that people carry with them, saying even if it's really hard, even when it's really busy, I can feel proud about what we are able to provide. Is tremendously, I think, invigorating and empowering for people across the board, and makes you keep on going every day because you make a difference. And you know that every bit of what you do makes a difference to the person that you're providing that care or advice or just a touch or just someone to talk to. It makes a difference to them. I think the support that we feel from the community, people are very aware of it. And I think people are aware of it on all levels. You look at a health service and you look at the premise on which we deliver healthcare in a public setting, and you say we are so dependent upon donors because at the end of the day, it's donors that enable us to provide a lot of the service that we provide. And people then reliably also have a reciprocal expectation that we deliver that standard of care to them. So I think it's such a mutual respect that our team have for donors and that donors have for us as well. And I think that's really palpable as well because we create, for us as well being a trauma center that is associated with a specific name as well in the community, as with the Eva Les Erdy Foundation as well, I think really makes a difference to people feeling part of a community. And we know that it's funded by the community for the community. And so you reciprocate that donation and that input as well.